Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper jaw. Starting with the upper central incisor region, we've got very thin ridge at the crest. It's approximately 3 millimeters. Below the crest, it's approximately 5 millimeters. And then the ridge length total is approximately 15 millimeters. Moving to the region of the lateral, we've got slight bit of an extraction socket here. Again, if this area is to be measured, we've got 6 millimeters of ridge width below the crest, mid socket level, and 11 millimeters of height. D3 bone quality. Region of the canine, we've got slight good bone here, 6 millimeters of ridge width with a good 18 millimeters of height. And we move towards the region of the 5, again very good bone, 5 millimeters of ridge width with 10 millimeters of height, D3 quality bone, and in the region of the 6, as you can very clearly see, it slightly enhanced the field of view. There we go. So this is the region of the 6 where we've got a slight bit of a VDR situation, and here you can see that we've got a very poor bone quality in this region. But if this it has to be measured, we've got an approximate ridge width of 10 millimeters and a height of just 8 millimeters. So moving to the upper left side, we've got this is the central incisor region, and then we move on to the lateral region. Again, very thin ridge here, just 3 millimeters of bone width or 4 millimeters, 16 millimeters of height. In the region of the canine, again we've got slightly better bone, 5 millimeters of width with 17 millimeters of height, and this is the premolar region. Again, if this is extracted, we've got 8 millimeters of width and 10 millimeters of height. And then we've got the second premolar region, again BDR infection, 9 millimeters of width with 9 millimeters of height. And then this is the sixth region, which is periodontally compromised. So the upper right 6, as you can see, not doing very well. If it is extracted, you've got 13 millimeters of width, but only 6 millimeters of height. So this will need an internal sinus bump or a shorter implant when it is placed. Thank you very much. And this is how the implants will look.